6:37 on a Friday. The announcement straightforward. In the words of the president, if you're fully vaccinated, you no longer need to wear a mask. So we're going in depth on these new guidelines with our ABC 15 health insider, Dr. Janice Johnson from Redirect Health. So Dr. Johnson, no masks, no social distancing. In your opinion, is this back to business as usual?
Well, this is an amazing day that we've had over the last 24 hours with this announcement. What this announcement is showing us is how effective these vaccinations are. We know that people are 100% protected, essentially, after being fully vaccinated.
Okay, so here's the thing, though. I mean, 2 weeks ago, we were told by the CDC to keep wearing masks indoors. This is quite a reversal in policy here. So what do you think changed?
Well, there have been studies with respect to people being fully vaccinated. One, do they get sick? And then secondarily, can they transmit the disease as well? So this is a big milestone, and I would just highly encourage people who've been on the fence about getting vaccinated to do so.
Okay, so another sticking point, especially for parents, if your kids can't get vaccinated yet because they're not eligible, should you still wear a mask?
So the latest CDC guidelines are only for these for people who have been fully vaccinated. So if you've got children or yourself who haven't been vaccinated yet, we still want you to be practicing these safety precautions.
Okay, and here's something that you and I have discussed off camera quite a bit as well. If someone says I'm vaccinated but not wearing a mask, could I still be infected by one of the new variants that we worry about?
So that's always a concern. I think as time goes on, we'll learn more and more about variants. But right now, we do see that the vaccinations we have in place currently are highly effective against these variants. Viruses change, however. So as time goes on, we may see that the vaccinations may need to be tweaked or not as effective for new variants that come along.
Yeah, and we've discussed that before, too, with the studies. So far, they're pointing to the fact that they are pretty effective against these variants. So, of course, we're hoping it stays that way. But also, to your point, as new variants could possibly pop up, then that may be time to worry. And as always, I mean, these rules could be reassessed. It's still a new virus, so this is something that we may need to continue to look at.
That's right.
Okay, Dr. Janice Johnston from Redirect Health, our ABC 15 health insider. I want to thank you for waking up early with us. I owe you some Tim Hortons coffee.
You sure do.
Yeah, I owe you many cups at this point. But thank you so much for always dissecting these issues with us and letting us pick your brain this morning. So thank you for that. Allison?
Thank you.